Hey everyone, so I just want to apologize that it's been so long since I last did a video. Um, I didn't do one at all really last quarter, and I apologize for that. School got extremely busy. The two classes I was taking kept me very stressed, but I passed both pharmacology and fundamentals of nursing. But like I said, it was very stressful. We were on campus 5 days a week, plus clinical, plus skill lab, plus all the assignments we still had to do every week, ranging anywhere from papers to projects to just discussion posts, everything. So definitely kept me busy. And I apologize. On this quarter, I'm going to try and do better. We're just starting week 3 of quarter 6. And I love it. I just had my first clinical day yesterday at the hospital, which is the first time actually being in a hospital. Last quarter, our clinicals were at a nursing home, and the environments are completely different. I really don't even know how to explain it, but it's so different, and I loved yesterday. On top of that, not only was yesterday like my first clinical day, it was also my perioperative experience. So that's the day that I was in the perioperative department, the whole clinical experience. And perioperative is the OR. So it was really cool. I got to see 4 different cases. One was repair to a fractured femur, head, and neck. So I got to see him go in and do that. One was to an elbow joint that had been, they were putting screws and plates in it. One was a broken wrist. She fractured her wrist. And so he cut her from wrist to elbow and opened her up. And being able to see that was really cool, because in A&P 1 and 2, a lot of our dissections or cadaver experiences were on frontal facing patients. So they were already the skin was removed from the front up, and you were looking down into the body, whereas this was a view from the side, and so you could see in and see the bone and see exactly how thick the layers of skin were and the muscle were. So I just really thought that was cool. And then the last procedure, it was really my first one, but the last procedure that I saw yesterday was a lapida. I forget what it was called, but they basically went in and they shortened one of her big toe. They shortened her big toe. She had gout, and so it was really cool to see that and connect it, because we were just learning that in class. And they removed a specimen from between her second and third toes. So it's just really cool to see that and see how they did procedures like that, and to get that experience. The nurses that I worked with in the perioperative department were extremely nice and extremely friendly. They were trying to help me, get everything and see everything. They were explaining things, explaining equipment and procedures, and the different roles of everybody who's in the OR room. It was just really cool. The camaraderie too between the team was very refreshing from the nursing home experience, where they just didn't really work well together and they weren't very cooperative with you, and so it was just a really good day. Overall, I loved it. It was exhausting, but it was so worth it in the end. And so I kind of also in this video wanted to do a little summary on the books that I'm using this semester. And like I said, again, I'm so sorry for last quarter not being able to do updates videos. Time got away from me. I literally had to set things in my phone, timers, to remind myself to eat dinner or to go to bed or to take a shower, because we were just thrown so much work, and because I have an hour commute each way, I was rarely home. So when I was home, I was hitting the books, sleeping for maybe a couple hours, I really didn't see my family much at all. I didn't hang out or anything. So it was stressful. This semester is a little bit better. We're only in week 3, but I came home the first day. They gave us every piece of information that we needed to know for the quarter. So I was able to get organized from day 1, and that helps a lot. I cannot stress to you the importance of staying organized in nursing school, or else you will miss deadlines. You will miss when assignments are due. It's crucial to nursing school. So I was able to do that day 1, and I've been able to keep up with my work and get assignments turned in on time. I'm at school a lot, but I'm not every day of the week. I'd say I'm there. Occasionally there's, I think, like 2 weeks throughout the quarter where I'm only on campus 4 days instead of 5 days. But when I am there, it's not there from 8 a.m. to 5 p.m. like it was last quarter. It's maybe 3 or 4 hours. I mean, my longest day right now is clinical shift, which ranges from like 6 a.m. until 3 p.m. And then on Mondays I have class from 8 until 2. But again, I have time to come home, get my work done that I need to get done, and still actually have time to spend with my family. So it's different, but it's nice, and I do have a little more time. Part of that is my organization. Part of that is like keeping up with the schoolwork. So it's nice. I wanted to just show you some of the books that we're using this quarter for school, because just in case you're interested, I really like the books this quarter. Let me get my mental health book. This one was still in my book bag. So for mental health, I'm taking mental health in Nursing 1. My Nursing 1 class is also MedSurg, so depending on what campus you are, that might be a class that you're taking soon as well. But these two classes, the textbooks correlate a lot with each other. And so I think that's why our school did it at the same time, because a lot of the information is repetitive and seen in one class and then seen in the other. So this is my mental health book that I have for this quarter. It's the Essentials of Psychiatric Mental Health Nursing. This is the revised print. I got it off Amazon. I get all my books off Amazon just because it's cheaper than buying it through the school. And our school gives us the e-print books, which is like the electronic book, so we can go on and log on. But for these classes, I've found that having the hardback book to go through and like do highlights in, or take notes right in the book, is just so much more helpful to me. Also, I can take this to school and follow along with the teacher as she's going through the book, and any like notes she makes aside from PowerPoints and stuff, I can just write in the margins or write on my notes, and that way I'm not taking notes and wasting time in class writing something down and possibly missing something else that she's saying. So this is my mental health book. It's okay. I mean, there's nothing really special about it, but it's a good book. This is the main one we use for mental health. On top of that, this other book really goes in conjunction with mental health and Nursing 1. Sorry. I keep them in the box. I bought these off Amazon from somebody used just because we don't use them frequently, but I will use them throughout the course of nursing school. And those are the ATI books, which you can also see online and keep the PDF. But again, I'm a hardback person, so these are the ATI books. And we do use these ATI books in mental health and Nursing 1. This is the MedSurg ATI book. In case you just want to get them separately, you can get them separately online at Amazon.com. This is the RN Adult Medical Surgical ATI book. And it's nice, after every section it has ATI questions. And a lot of times these questions show up on our quizzes or exams in class. So I really recommend these books. These books are pretty good. Not my absolute favorites, but they're definitely helpful for the class. And then for mental health, we have, where's my mental health? Here we go. Our mental health book is the green one. The edition 9.0 edition. There's different editions. There's also an RN mental health and a PN mental health. So make sure you're getting the right one depending on what nursing course you're taking and what your class is requiring. But these are very helpful. Even if they're not requiring, I kind of would recommend you to get these because they are helpful. They're helpful in summarizing in small paragraphs what you're learning and what the topic is about. Another book I recommend you getting for nursing, especially if you're working in the clinicals, and this is something I carry around with me at clinicals as well because if I'm doing med passes, we're going to need it to go back and look at the drugs and make sure that specific medications aren't interacting with them. But I recommend you getting some kind of drug guide, and this is the Davis Drug Guide for Nurses. I use this the past 2 quarters for school. And it's really nice. It's got a condensed version, and it basically just tells you, here's heparin. So it tells you the drug here, and whether it's high alert or not, it'll have that. If it's not high alert, it'll just look like this, and it won't have a high alert sticker on it. But it just gives you the classification, therapeutic and pharmacologic, the pregnancy category, indications, action of the drug, how it's absorbed and distributed, the contraindications and precautions, adverse side effects, interactions, the route and dose for different age groups. It gives you some assessment details for nursing assessments, some nursing evaluations, and teaching points as well for your patients and their families. And it's just a very good book that I highly recommend you getting something like this. This is the Davis Drug Guide for Nurses 14th edition. There are different editions. I would strongly recommend either the 13th or 14th. They're more updated, but definitely want to have these for clinicals or even if you're getting up there in the nursing, starting actual nursing classes. It comes in super helpful for any drug guides or exams you have to do with drugs. So I recommend getting something like that. I also purchased this one that my teacher specifically suggested for us. It's the NCLEX Drug Guide. It's on Amazon as well. I want to say I got this for I got this for like $11. And it's, again, super helpful. It's broken down into different sections, so you have mental health drugs, nursing 1 drugs, but it gives you the drug on one side of the paper, and then on the other side it gives you the major side effects and nursing considerations for that drug, and that's kind of like the high priority things that you need to know about the drug. So this is also a pocket one that you can take. I take this with me a lot of times to clinical, and I leave the other one at home for schoolwork and stuff, but this one's just easier to fit in my scrub pant pocket. They also have apps on your phone. If you get the Skyscape app, they have a drug guide and a lot of resources on there, but it depends on your hospital policy or where you're going, whether you're allowed to use electronic devices. Some of them, they don't want you to have your cell phones and stuff out, so having like a little pocket guide like this is always super helpful. The next book is my MedSurg book, which I bought on Amazon used. It's huge. This is Contemporary Medical Surgical 2nd edition by Rick Daniels and Leslie Nichol. It's huge and heavy, but this is just the book we're using. It's really good. It's got a lot of information in it. I like it in that it takes each disease, like we were just learning about the musculoskeletal functions, and so it'll have, here's an example. It'll have I think this is osteoarthritis, yeah. So it says osteoarthritis here, and then underneath it has each of the subcategories. So it's got the epidemiology, the etiology, the pathophysiology, talks about it, the assessment with clinical findings, diagnostic testing, nursing diagnosis, planning and implementation for the specific thing. And then it'll go into evaluation of outcomes, surgery procedures, And then it has the next one, and it'll have gout, which we were just learning about, and it has the same information for that. So it's very well constructed to where it's all together in one place, and it's all right there for you to use, so you're not like going through the book like these are all the pathos and these are all the nursing considerations for them, and then these are all the, it's just, this is all you need to know about gout, this is all you need to know about osteoarthritis, this is all you need to know about rheumatoid arthritis. So it's got it all spaced out correctly. The next book that we were required to have was the NCLEX Success Book. This is our comprehensive review for NCLEX RN. Strongly recommend this. My school has a pass rate on the NCLEX when you take it of a 90% or higher. I can't remember the exact statistic, but I know that for the past 5 years they've had over 90% passing rates. So they stress the NCLEX, and a lot of their tests and exams, quizzes and exams for Rasmussen are built around the NCLEX book because they want you to pass. So they're all NCLEX style questions to get you prepared. So they recommend this book, and I also recommend it again. It's a very good book. I found it super helpful. They have each chapter's a different category, and it kind of just breaks it down into easy to read bullet points of the information to know for the category. So like here it talks about panic disorders on the top here. I don't know if you guys can see this, but it talks about panic disorders, and then it has listed on this in the bullet points the most important things you need to know about it. And then at the end of each chapter it has NCLEX style questions, and I found that a lot of those NCLEX style questions you see repeated on the exam. So definitely recommend this book. It's very helpful in studying, and it'll also help you prepare and get used to NCLEX style questions for when you do go and take your boards, because yes, surviving nursing school is important, but ultimately you want to pass the board so that you can be practicing and be licensed. So our last book that we use for nursing is our basic nursing book. Again, it's another thick, heavy book. Honestly, not one of my favorite books. It's hard to read. The other thing is this book, the MedSurg, and the ATI book, generally when we have readings in class, they are all very similar to each other in the chapters, and they're the same information, sometimes the same words. So find the book that works best for you, and just read that one. Don't read every single chapter of each book because it's really all the same information. For me, I really like the MedSurg book and the NCLEX book. I don't really read this one a lot, at least not for these two classes, just because there's so much information in there. It's not laid out really well. Really the only time I use this book, as I can show you, is for procedure steps, and they have in here, along with the readings, they have the procedural steps for different nursing skills. Let's see if I can hold this and tote you down. So here it's bathing, providing a complete bed baths, and it has step-by-step process of how you do it, the things that you need, the assessment things, and then it has steps like do this, and then you do this way, and this is how you do it, and then here's the next step, and it just takes it through, gives you examples of just how to do it. But that's really all that I use this book for, because when reading the chapter stuff, it's the same information from the MedSurg book, and I don't have time to read the same exact chapters multiple times. So I just have been using the MedSurg book. It's a good book. I just wouldn't, it's not one of my favorites. But again, it depends on the person and how you study and stuff. So maybe look at a friend's book if you know that they've had one, to see what kind of styling, what kind of reading comprehension works best for you and which book you should buy, because nursing textbooks are expensive, and so I wouldn't recommend spending the money on it if you're not going to use it. However, if it's required for your class, I mean, that's up to your discretion, and you have to make that. So as of right now, that's really all that I've been doing in classes, just a lot of reading. We had our first nursing exam last Wednesday, and I got an 84. However, that's going to change to an 88 soon because 2 of the questions on the exam, the answers were marked wrong, and I answered them correctly, but the answer key was incorrect, so she's got to go back and change those. So I did an 88, which was really good. A lot of people in my class got 78% or lower, and in nursing school, at least our nursing school, 78% is failing. You have to get a 78% exam average in order to pass the class, not including all your assignments and everything. So we had that. We have our first mental health exam this Wednesday. I'm slightly nervous for it just because it's a first exam. You never know how teachers are going to grade. It's always kind of like a toss-up on how it's going to go, but sorry for that background noise, guys. But you never know how it's going to go, so I am kind of nervous. I do have some like little anxiety about that, but I've been studying every day since the Nursing 1 exam for it, and I feel pretty prepared. A lot of it's about the Erickson's theory and stages and different cognitive levels of mental health. So that is coming up this week, and it's a little stressful, but I feel confident, and hopefully I do another great job and get even higher than I did on the Nursing 1. But yeah, so hopefully you guys will check back in. I hope to have another video up within the next week and a half, 2 weeks. Hopefully my plan, and just do an update on how my mental health exam went and my next clinical rotation, which will be next Friday, and that'll be my first time actually on the floor of a hospital. So I'm going to do a video after that. Probably not Friday afternoon. It'll probably be posted again on Saturday just because I get so stressed out and exhausted after clinical that I come home and crash because I'm on my feet all day and I'm running, and it's a long time frame. But look for another video very soon. Again, I'm so sorry about last quarter. I'm sure you guys, if you're in nursing school, understand. If not, and you're going into nursing school, you soon will understand. But nursing school is very time consuming, and it takes a lot out of you, especially when you're still in a lot of that book work, which I'm slowly being taken out of and put more into the actual nursing field in the hospital setting. But until I get there, it's a work in progress. So thank you guys for watching again. I'm so sorry. Be looking for a video next Saturday, maybe Friday if I have a really good day and I get it like put up, but for sure by Saturday there should be another video. Again, if you have any questions or like tips or ideas that you have for videos, I'll definitely be doing more videos this quarter for you guys, and so I'm willing to do whatever topics you guys can come up with. So leave those in the comments below, and thumbs up this video if you liked it and found it helpful, and I'll see you guys later.